Hi, this is Preetika Rao and today I have with me Dr. Rickson Pereira, who is MD in dermatology and who specializes in skin, hair, laser, botox, fillers and body contouring. He is also a well-known celebrity dermatologist in Bollywood. Welcome, doctor.
Hi, thank you for having me.
So acne is a very common problem amongst teenagers, and from my observation I have noticed that there are some common factors that cause acne. The first being unclean gut, second being unclean scalp, third being oil massages on the face. I have noticed that it really triggers very severe acne. And also bad diet or wrong food intake can cause acne. So am I right about it?
So acne comes from genes and hormones. If you have the genes for acne, you'll get acne. And hormones have their own role to play in acne. So after around the time of puberty, certain hormones become active, and if you have the genes for acne, then acne will express itself. The factors that you said, they could be contributory factors in acne.
Okay.
So like a bad gut or an unclean gut usually comes from a bad diet, and diet has a very important role to play in acne.
Absolutely.
Numerous studies have shown that diet in which there is typically a high consumption of sugar or very frequent consumption of sugar will worsen acne. Okay? And that sugar could come from day-to-day items like the sugar we add to our tea, coffee. It could be foods that contain very high amounts of sugar like desserts, things like biscuits, chocolates, soft drinks, fruit juices. All of these can be excessive consumption of these can worsen acne. So typically a diet that lacks fiber tends to cause a bad gut, and generally so both of these can worsen acne, because a bad diet can worsen acne. A bad diet can also cause an unclean gut, and that's where there is maybe an indirect relation between the two. The other factors that you mentioned, an unclean scalp. So in teenagers, typically under the influence of hormones, the scalp can become very oily.
Right.
And an oily scalp causes growth of natural bacteria and yeasts or fungi that are present on our scalp, and they can cause an overgrowth. And that overgrowth, they tend to overgrow and clog all the oil glands on the scalp and the forehead, and that can typically give rise to acne along the hairline. So this is very commonly seen in teenagers. So
especially I have noticed that, you know, when a lot of girls especially, they leave their hair open at night and sleep, you know, it's obviously the flake is like getting all over their skin, and that's causing them those breakouts. Am I right about it?
So the flake directly does not cause, like it's commonly thought that the flake will drop into your oil, into your pores and block. It's actually not that, but both dandruff and acne can coexist. Like the same set of hormones which will cause dandruff will also cause acne. So there's an indirect relation between the two. It's not the direct fall of the flakes into the pores that actually causes it, but the same hormone which worsen dandruff will also worsen acne. So that's why typically we see both those situations happening in teenagers very classically, and that's how you'll see that both of them go together. So it's very common to think that dandruff causes acne, but it's actually the oily scalp which causes dandruff, and the same hormone causes oily skin and acne.
All right.
And even products that are oily products that are used on the scalp to style hair, things like pomades or waxes, they can cause something called as pomade acne along the hairline. When those products come onto the forehead skin, they can trigger acne, or sometimes even at the back of the neck they can trigger acne. And there are other causes like supplements. You know, we are in an age where people are popping supplements left, right and center without medical supervision, and vitamin B12 is a very common cause of acne.
Really?
Yes. So high doses of vitamin B12 can trigger acne in someone who's acne prone. Even supplements like whey protein, you know, everybody is going to gyms now. It's become a fad to have whey protein supplements. And excess of whey protein can cause, can worsen acne. Typically, acne on the face, acne on the body. It's very commonly known. Then hormones, like everybody wants to have a ripped body and a bulked up body, and very commonly people resort to anabolic steroids to get quick results.
Okay.
And a very common side effect of anabolic steroids is acne, like severe acne on the face, severe acne on the body. So is a very common cause that we see nowadays. Especially, I mean, it's seen mostly in young men who are into bodybuilding.
Yes.
Yeah.
That is true.
So oil massages, like you said, oil on the face. So it's a very common thing to apply oil on the face. It's a very common fad, thinking that it will moisturize the skin. But applying oil directly to the skin does not moisturize it. In fact, it ends up clogging all your oil glands and worsening your acne, or it may trigger acne.
Okay.
So it's not a good idea to apply oil on the face.
Yes.
Oil in a moisturizer is fine. So there is a typical ratio of water is to oil that should be there in a moisturizer.
Okay.
So the same oil in a moisturizer or in oil in water moisturizer may not trigger acne, but applying oil directly to the face will cause acne, and it's very commonly seen after oil massages.
Okay.
Even the whole process of rubbing the face aggressively itself triggers irritation. So a combination of oil and an aggressive massage will trigger severe acne, like you said. It's again another common cause. So I think home remedies, one should be very careful and not get very enthusiastic with home remedies.
Absolutely. And from my observation, I have noticed that every single time I have gone in for a face massage, even if it's with a moisturizer, within 4 to 5 days my skin breaks out. And you know, we are so busy, all of us, that we really cannot, you know, relate it to the massage that we've taken, you know, maybe 5 days back. So we think that the cause is like something else, but I can say, I can tell you for sure from my experience that a moisturizer, face massages, especially moisturizer face massages, may not suit everybody. I feel that they actually trigger your oil glands and activate your oil glands.
Absolutely.
Yeah? And also face oil massages. Like, there are a lot of people, I remember my Ayurvedic doctor convincing me very hard to go in for, you know, a face massage with olive oil, and she promised me that I will have glowing skin, and by the end of it, I think we did this massage continuously for 3 to 4 days, and by the end of it, I had such heavy, you know, acne breakout on my face that and itchy. Okay, so I used to literally wake up at 5 a.m. with all that itch on my face. So I would really recommend a lot of people there to be careful. I would advise you, please don't just blindly apply oil on your face, because I think from what you've spoken to me, I think oil is a big no, right? Oil massages are a big no.
Absolutely, and sometimes doing less is good.
But there are some people, very rare cases, who tell me that oil massages really suit their skin. So is it because they have like very dry skin, or what is exactly happening with them? Or is it because, you know, after a certain age it doesn't trigger the oil glands? How does it work?
They're just fortunate not to have acne, so maybe it suits them, but you can't use one brush for all. And so if particularly if you have acne prone skin, it's best to avoid it, because oil massages actually don't offer any additional benefits than just applying a moisturizer. And if you apply a moisturizer gently on your skin, it will serve the same benefit as an oil massage.
Absolutely.
So I mean,
so why put excess of oil content on your skin? Let's talk about the cure. Like, if there is very severe acne on the face, how long does it take you know, for your skin to become blemish free? And do you have any like new age treatments for it right now?
So the treatment of acne depends on how severe the acne is, whether it's mild, moderate or severe. Depends on how long they've had it. If they have, you know, when we start treatment with first line medicines, if they don't respond to it, then we treat it with higher grade medications. So you have creams for acne, you have those are topical applications, then you have oral medications for acne, and then some other supportive treatment like peels, lasers. So those are used in the management of acne. And then you have treatments for acne scars. Like once the acne has gone away, then we treat the scars with devices such as lasers, radio frequency, and something called as microneedling. So depending on how severe the acne, so generally we start, if the acne is very severe, like then we have to give oral medications, or if the acne is on the back or on the body where it becomes very difficult to apply creams, then we give oral medication. So it's usually a combination of oral medications with applications, and in case sometimes a person like especially girls, if they have hormonal imbalances like irregular periods, you know, sometimes they show signs of abnormal hair growth on the face and the body, then we also add hormonal medications if needed, if the acne is not responding to conventional acne treatments. Based on what we are presented with, we decide a combination of treatments, and it's usually a combination. There's no one medicine which works in acne. So it's usually a combination of creams, oral medicines, and sometimes we will do peels to help the acne dry up faster, heal up faster. Peels and lasers help lighten the marks of acne, so they speed up the whole clearance of acne. Usually it can take up to 3 months for the acne to clear out completely, especially when we are dealing with severe cases. And typically the acne treatment goes on for at least 5 to 6 months, in which the acne is cleared, and then we recommend some maintenance topical creams in order to maintain the results, and lifestyle measures like eating healthy, choosing the right products. So those help minimizes recurrences of acne.
So drinking a lot of water, fiber intake, and I'm sure keeping your scalp clean, I think that also is going to help you guys.
Absolutely.
So just one question I want to know, these medications to target acne, would they have any mild form of steroids?
So it's a common misconception that acne is treated with steroids. It's not. In fact, steroids cause acne. So they are not used in the treatment of acne. Very, very rarely there is a hormonal issue called as congenital adrenal hyperplasia, which is also in which one can develop acne, and it's a medical condition in which a steroid has to be given. So that is the only situation where we give a steroid, but it's very rare. So routinely in acne, steroids are not to be given as a cream or as an oral medication. It's a myth, and it only worsens acne. So we do not use that in the treatment of acne.
Very commonly, dermatologists, especially in India, recommend Isotretinoin, which is a very high dose of vitamin A, which I have been advised not to get into, you know, this treatment of consuming Isotretinoin for acne. So what is your take on it?
So Isotretinoin is from the vitamin A family of medications. So it works on the oil glands. So in acne prone skin, there is a tendency for skin cells to stick together and form blackheads and whiteheads, which gives rise to acne. So Isotretinoin corrects that abnormal behavior. So it only targets the oil gland. It's not a hormone, it is not an antibiotic, and it is a very effective treatment in severe acne. But the medicine should be taken under medical supervision. It is not something that one should, although it's available over the counter in India, but it should not be taken under medical supervision, because it is not supposed to be taken by women who are pregnant or are likely to get pregnant during treatment, because it can cause birth defects in the baby.
Absolutely, yes, I've heard that.
Yes, there are certain side effects with the medicine, such as very commonly we see hair fall, lip dryness, skin dryness,
dry eyes.
Dry eyes. So anyone who has severe eye disease, liver disease, they should not be taking this medication. So that is why it should be taken under the supervision of a doctor, because then they will ask you all the relevant questions and ensure that it is given to you when your body is absolutely able to take it and tolerate the side effects. Certain other supportive products like lip balms, moisturizers, gentle cleansers, all of these need to be taken. You need to protect your skin from the sun. Like the skin becomes sun sensitive. You cannot wax for those 4 or 5 months that you take the medication. So certain lifestyle changes, certain precautions need to be taken when and extra skincare has to be taken. The results are really good, but it comes with all these sort of, precautions and care that needs to be taken, and a doctor will explain you that.
And the birth defects that this, which is a side effect of isotretinoin, after how many years of consumption of this particular course do you think that there are chances of birth defects?
Right. So isotretinoin is cleared out of the body in a month's time, and we so a woman can plan a pregnancy ideally after a month. In India, we are a little extra cautious, so we say wait for 2 months.
Okay.
But the older guidelines used to mention 6 months, which we still follow in India. So all the packs will carry a 6-month interval.
Okay.
But world over, 1 month is the guideline. That's what we read in textbooks also.
Thank you so much for your tips and advices, and stay tuned because we will have many more sessions coming up, and we're going to speak about how you can have a good skin and of course the right treatments for a healthy skin.